Dalawang buwan na po ang nakalipas since na-impose ang lockdown on Metro Manila and other major cities across the country. And when it comes to public health policy sa panahon ng COVID-19, ang parating pinag-usapan ng tao is mass testing. Well, unang-una, may consensus, more or less among the top experts around the world, including from the World Health Organization, na kailangan mo ng mass testing because this provides you an opportunity to know what is really happening on the ground. Dahil kung wala kang mass testing, you are essentially walking around blind. Hindi mo alam what is the exact situation on the ground. Ngayon, how do you define naman mass testing? Of course, mass testing is not like census po, no? It's not going around and testing every single person in the country. Now, it's also not like conducting a survey where you look at a sample, no? A representative sample of, say, a few thousand or 1,000 Filipinos from across the country to draw a conclusion about what is the general public opinion. Now, the emerging consensus among leading countries is that siguro, you need to at least test around 1 to 2% of your population. For countries like Germany, which is now the gold standard for fighting against COVID-19, they have actually tested more than 2% of their population. Top experts agree that that's the way forward. Dahil kung meron kang mass testing, you test a significant number of the population, especially dun sa mga areas na hotspot, then alam mo anong mga communities or persons na dapat i-quarantine mo para hindi mas-spread yung disease. As early as March, experts like Christian Drosten, a Berlin-based virologist, have argued that mass testing has been very crucial to the fact that Germany has one of the lowest death rates among major affected countries. And more recently in the United Kingdom, Professor Chris Whitty, one of their top virologists and experts, has also called on the British government to follow the German model. But how do we conduct tests? Let's have a brief overview of that. There are at least 3 types of tests when it comes to detecting COVID-19. The first one and the most famous one is the diagnostic or the PCR test. PCR stands for polymerase chain reaction. Ang ginagawa dito is they take a mucus from your nose or from your throat. Medyo intrusive yung test na yan. They take a mucus from your nose or from your throat and then iti-test nila yung sample na yan in order to find the genetic material of the virus. Number 2 is the antibody test. Now, what you do in the antibody test, this is not to really detect whether a person is sick or not, but to have a general idea ilan bang nakasakit sa isang bansa. Ang antibody test naman, ang tinitignan dyan is traces of the antibodies that you produce in your system to fight against the virus. And the third one is the so-called antigen test. Now, the antigen test is not like your antibody test and it's not also like your PCR test. Ang tinitignan dito is yung traces of protein from the virus. It's not seen as accurate as PCR and it's more used as a screening mechanism to see whether a person may have a high probability of already getting infected. So ito po yung mga 3 types of COVID-19 tests na meron tayo. Now, back in April, sinabi ng gobyerno na we're also going to move towards mass testing and that we can test up to 12,000 people a day and we're hoping to push that number to 30,000 people. The hope is down the road we test around 1 to 2% of the Filipino people and much of it will be concentrated in the hotspots like Metro Manila, Cebu, and surrounding provinces of NCR, National Capital Region. The problem though is that we have been getting some contradictory or seemingly incoherent messages from Presidential Spokesman Harry Roque and other top officials in the government. Earlier this month, Presidential Spokesman Harry Roque inadmit niya na we did not meet our target of around 8,000 tests per day, but more like 7,000 per day. I'm not sure paano natin maabutan yung target na around 2.2 million people in the Philippines or around 1 to 2% of the population if ganun kabagal yung testing capacity natin. And after all, we hemorrhage our economy after 2 months of lockdown. What did we make out of the 2 months? Because if you don't have an effective mass testing, you don't have an effective public health policy. Ako po si Richard Hidarian. Stand with us, stand for truth.